Sound check. Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way, Yorkville. Happy Monday, guys. It's good to see a lot of you. I know I haven't been live on a Monday for a little while just because I was going live on Sunday night just to make sure I could get to family events and things like that. However, I wasn't going to make a habit of it. With some of those things finishing up, I am able to go live Monday night, which is my preferred time. So just finished up with patients not that long ago, and it's great to see. A lot of you on. I know that we have a lot of people that are watching right now. So if you are watching right now, whether it's on YouTube, whether it's on Facebook, it's on Rumble, just make sure you say hello. Let me know where you're watching from. And I love to see where people are watching from. I know that we have a lot of longtime lurkers. But if you have been a lurker for a long time, thank you very much for watching. But just let me know that you are out there. Just say hello and also where you're watching from. So today I want to go over a couple of things, common health misconceptions that you might keep falling for. So I'm going to kind of bust some of the myths that are out there that a lot of people, think that are true, and I'll let them know. We'll help set the record straight in regards to that. And so I will be talking about acute pain. I will be talking about vitamin D. I will be talking about your immune system. I will be also talking about something very provocative about why medical doctors are not experts in health. I'll explain to you why, but I'll go over some misconceptions that a lot of us just kind of believe just based off of what we have heard or based off of social media, things like that. Before I do that, I'm going to go over a couple of recalls in regards to medications that should actually frustrate you, maybe piss you off a little bit. I apologize for saying that, but it's the appropriate word. Or just really just one of those things that kind of makes you go, I wonder what's going on here. So, common health misconceptions that you might keep falling for. And again, if you are watching right now, whether it's live right now, say hello, let me know where you're watching from, or if you're watching the replay, going back and watching, because I know Facebook will delete this after I think 30 days or so, but you can still find it on YouTube and also on the Rumble platform. So if you're watching on replay, just go ahead and say hello and then type in replay so that you're going back and watching it too before it gets deleted from Facebook. Okay. So common health misconceptions that we might keep falling for. However, I want you to know this because I said this last week and I'm like, this is something, It should almost be like the wellness way creed. Okay. We think and act differently to solve the health challenges that others can't. We think and act differently to solve the health challenges that others can't. One of the things I want you guys to understand is because, go on social media, man, I will say this: medical doctors are just up in arms that we're seeing people, that someone comes to me and that their approach has absolutely failed them, and they're mad that they come to see me and they get better. And if they are a doctor, they should be very happy to say, hey, maybe you should try a different approach, and they get better. You should be happy, because if you're truly in the healing arts, you should not be concerned about how you got better. You should be most concerned about if you got better. But the problem is there's a lot of ego-driven doctors that are out there, and they're just concerned about their way or the highway. But think of this: every single person that's coming to see me has tried the medical approach, and it's absolutely has failed them. And if it's failed them, then I would actually say then we have to start thinking and start acting differently so that we can solve your health challenges where other people haven't. So that is the main thing of what we're doing within the Wellness Way. And speaking of that, within the Wellness Way, guys, if you're from the Chicagoland area, coming up, this is tomorrow, November 4th, on a Tuesday at 6:00 p.m. This is an in-person event. And if you're from the Chicagoland area and you want to work with the Wellness Way approach, you want to work one-on-one with me, make sure you get registered for that inflammation event, whether it's challenges in regards to weight loss, or if you have immune system issues related to cancer or low immune system function, infertility, thyroid disease, chronic pain, arthritis, type 2 diabetes, autoimmunity, hormone issues. All of those things are related to inflammation, guys. And the problem is that so many people don't understand what inflammation is or where it comes from. And so if you can understand where it's coming from, that's the first step for you to start to understand and start to think a little bit differently. And know you're not just a teaspoon of turmeric away from having ultimate health. It goes a lot deeper than that. I remember I was talking to a gentleman today who had chronic joint pain, back pain, neck pain for about 4 months. It was so bad he could hardly get out of bed. And so started working on him and started correcting some of the physical, some of the chemical stressors. He looked at me today. I was in a consult with him, and he said, man, am I so glad that I met you. I was just in a really bad situation, 3 to 4 months ago. He's like, now I feel awesome. I feel amazing. But I do realize that getting better takes time. He didn't get sick over time, and it takes time in order for people to get better. But he's doing really, really awesome, especially dealing with so many chronic issues for such a long period of time. So if you want to work with us directly, you're from the Chicagoland area, then please register for the inflammation event that's going to be tomorrow night at 6:00. We only have one more until the end of the year. That will be in December. So if you miss that, then your next chance will be in December. But if you want to register for that, gosh, I think we might be close to capacity, so I'm not for sure. But if you go and you just follow our link tree, that'll be at the top of all of our socials, and you click on that, you'll see that the first thing to show up will be the inflammation event. So if you click on that little link that you'll see will shake and vibrate back and forth. If you click on that, that'll take you to Eventbrite, and it'll take you about 60 seconds to register yourself for that event. The only thing that we ask is if you register for it, you're committed to showing up and also being here on time, if not early. So we start promptly at 6:00. So get registered for that free event. And when you get registered for it, we also have a gift for you at the end of the event. So make sure you get registered for that as well. Now, I still have people reaching out to me too about how to work with me remotely. And so if we are opening up some remote consults, although we are getting filled when it comes to that too. But if you want to work with us and you're not from the Chicagoland area, then we will open up some remote openings for people to work with people, over the phone and be able to get the testing to you. However, this is going to be, you have to be a man, you have to be within the contiguous United States, just so we can order the labs for you and get things shipped to you the way that it's supposed to and the way that they are needed. So for men, if you want to work with us, make sure that you reach out to our office. Make sure that you just call our office at 630-553-6149. That's the easiest way. A member of my staff will reach back out to you, get you scheduled for a a remote consult to work with me one-on-one. We only do remote consults at certain times just because of our schedule and things like that. So please reach out to us. If you are not from the Chicagoland area, you're a man, but you live within the contiguous 48 states. And then we'll do our best in order to accommodate you as best as possible. Okay. All right. Here's what's interesting, and I don't understand because a lot of people probably haven't heard this. But if you follow recalls and things like that, which I do, this showed up last week. So in AARP News, and this was in a lot of other news organizations as well. But the headline reads: cholesterol medication recalled, over 140,000 bottles affected. So this popular cholesterol medication known as atorvastatin, which is a generic statin medication, is being recalled mainly because of the how it was manufactured, and it's not getting absorbed. So you're taking a statin medication, it's not getting absorbed. Now they're recalling and saying, "Whoops, we messed up with the manufacturing," which kind of makes you wonder. But I would actually say this is probably a lot of people probably are having a lot less severe symptoms of being on a statin medication. I've talked about that a lot. If that wasn't alarming enough, here's something that's probably even more alarming as well. And this came out last week too. Blood pressure medication recalled over high levels of cancer causing chemical. Okay. The drug, commonly referred to as prazosin, is a type of alpha blocker used to treat hypertension or high blood pressure. And so now when you look at this, you're seeing two medications just within the last week being recalled, only because there's high levels of cancer-causing elements in it, and also the other one's just not getting absorbed. So here's how I'd like to address that. Now, I want you to put the shoes, put the shoes on a different foot, and I want you to think about this. If this was a supplement, so if this was a supplement that they tested that had cancer causing things inside it, how many medfluencers would be talking about it? Probably almost all of them. The Dr. Terry Simpson, the Dr. Allo, I mean, all these medfluencers who are just so bought and paid for by big pharma. And I hope they're watching and they get this message, but they're not saying one thing about it, nothing that would actually put medicine in a bad light. But would they be talking about it if it was a supplement? Yes, they would. Absolutely, they would be talking about it. But how many are talking about it right now? The answer is zero. None of them are talking about it at all, which kind of makes you wonder when they don't talk about. You should be just as critical about medicine as you are with everything else. You should look at everything with a critical lens. And in fact, I'm going to talk about my own profession, how I disagree with things in my own profession as well. But if you see something as serious as that, then if you are a medfluencer, you have a high social media following, you should be talking about this. And this should absolutely not only alarm you, but it should probably enrage you too. All right, guys. So common health misconceptions that you might keep falling for. I'm going to talk about 5 or 6 different things that a lot of people in the quote unquote natural health just they get wrong so often. Okay. Now, if you look at this, you might have seen this video or you might have seen this meme uh, in the past, but this is someone who is pulling out a sheep who got stuck in a ditch, gets pulled out, and then quickly runs away and then falls right back into the ditch. All right. Now, um, I would be remiss to say that many times I feel like this, pulling people out of health challenges that they have, only for them to just go back to the same destructive lifestyle that got them stuck in the first place, and for them not to be able to figure it out. So yes, I put this on here because many times, at least once a week, I will feel this way. All right, so if you are pulled out of that, then the thing that I tell people is then remember what got you well so that you don't go back to what made you sick. But unfortunately, we don't learn very well. In fact, I call that double loop learning. And in fact, if you want to improve your life, you want to improve your health, double loop learning says I do something, it doesn't work. And so I figure out a strategy to change that. And then I change what I did in order to make sure that I'm not going back to what didn't work before. So let's talk about some misconceptions that a lot of us have fallen for. So, number one is this whole idea behind treating disease. Man, you will see this quite a bit about how doctors who believe that they have a monopoly on health think that the only way to quote unquote treat disease is through their pharmaceuticals and for their medications. Am I opposed to it? Nope. And in fact, in the inflammation that I talked to you about, if you're having a heart attack, then you probably need some kind of surgery or some kind of medication in order to save your life. We call that the fire department. You need the fire department. The problem is that after they put out the fire, they're not trying to figure out what caused it, and they're doing nothing to rebuild the body after there's been so much collateral damage from being on a medication or having a surgery or doing this for a very, very long time. The problem is that we're always concerned about treating disease. But the truth is this, is that you don't want to focus on treating disease. Instead, what you want to do is you want to work on building health and restoring normal function. This is why so many times I have people who come to me at the 11th hour, and expecting some kind of miracle to take place in 1 or 2 days. Meanwhile, they've been sick for decades. But the reality is that you need to, instead of treating disease, you should focus instead on building health. It's the same thing, if you look at the gym, come January 1st, there's all these people that are going to be in the gym, exercising to try to lose weight. And here's the thing. I don't go to the gym and try to lose weight. I don't try to go to the gym to do anything. I go to the gym in order to build health. So, um, and I'm not super excited to do it, but it just comes down to maturity because I want to have normal function taking place inside of the body. And this is why I talk about this at the inflammation event is I talk about, where do people get sick? Mental, chemical, physical, mental, chemical, physical, mental stress, chemical stress, physical stress. All those things can affect the function and the restorative capacity of the body to be able to heal. And the body was designed to heal. And when you start removing those stressors and you take some stress off of the body, then now what happens is you start to allow the body to have permission to start to heal. So this is why looking at mental stress, chemical stress, physical stress are going to be so important. And you need all three of those. But the thing that I will tell you is this, is that medicine really just only gives lip service to building health. And here's the proof in the pudding is go to a doctor and they charge you $300 for a 5-minute appointment in which the doctor took 5 minutes to look at your labs and told you, hey, you're type 2 diabetic, you have high cholesterol, you have something like that. You need to be on this medication. You need to be on a cholesterol medication, a blood pressure medication, or you need to be on something in order to lower down your blood sugars. But they give very, very little direction on exactly how to pull you out of that crisis or pull you out of that condition. They'll usually just say, you need to exercise and eat better. And meanwhile, you're looking at them and you're saying, no duh, Sherlock. I knew that, but can you please tell me how? And most of the time that they can't, only because they'll just throw out some terms like, oh, you need to eat less saturated fat, or you need to eat a Mediterranean style diet, or, you just need to exercise. Well, tell me how to exercise. And they won't give you specific instructions on how to do that. And really what it comes down to is they're just giving you lip service. Because if you walk out of there with more instructions on how to take your statin drug than you do on how to properly exercise or how to actually eat right, then you no longer are going to someone who's an expert in health. You are going to a drug pusher. Sorry, I just had to say that. So medicine really just gives lip service to building health. But I want you to think of this. You're like, oh, no, I want to build health. Well, the thing is that, I run into people and they treat their health like they treat, almost everything else in their life. It would be like me saying this. If you're like, I'm not concerned about my health until I have a disease. It would be like me saying, well, I only give my family or I only give my wife attention when they're upset at me. Okay. Very reactive focus. Or, I just went to the dentist. I had 3 cavities. I need a root canal and I need 2 crowns. Now I'm going to start brushing my teeth and I'm going to start flossing my teeth. So you don't start brushing and flossing until you have been given the bad news of having, multiple dental cavities. Or I only work out just to treat my type 2 diabetes. That's the wrong thinking. That's the wrong approach. That's treating versus building. And there's a big difference between the two. So what it comes down to is just comes down to having the maturity of having the right mindset, and come hell or high water, I'm going to do these things because I'm going to build health and I'm not going to try to treat disease. Here's misconception number 2. Vitamin D is needed when I'm sick. Have you ever run into that? And it is true that a lot of people do have low vitamin D, but I will actually say this: more vitamin D is not necessarily better. And in fact, the goal of vitamin D is to have sufficiency. Now, do a lot of people need vitamin D? Yes. I have seen a lot of people come in who are very deficient in vitamin D. And yes, vitamin D does affect the immune system. Vitamin D does affect, regulatory T cells. And in fact, the biggest thing is it's affecting mostly the adaptive immune system. But and there can be a huge benefit to having sufficient vitamin D levels. But just remember this: adequate vitamin D doesn't necessarily mean that you'll never ever get sick. Because I've seen a lot of people are like, oh, well, I got the sniffles. So I decided to take, 25,000 IUs of vitamin D for the next 2 weeks. And then I got the sniffles again. So I took more. And I have seen people who are just basically taking way too much vitamin D. And it begs the question, because I know someone's going to ask me, well, how much vitamin D should I be taking? And the answer is, I have no idea. You know why? I've never seen your labs. I don't know if you have adequate gallbladder function. I don't know what your body fat percentage is. Um, all those things play a role in vitamin D absorption. I don't know if you're taking any vitamin D, with a meal, in which, because you need bile in order to absorb vitamin D. I don't know any of those things, but I do know that generally speaking, your levels should be anywhere from 60 to 80 is where I like them to be, milligrams per deciliter. And I actually do test my vitamin D a couple of times a year. My vitamin D sits usually between 80 and 90. So, but if you're having the sniffles, taking more vitamin D isn't necessarily going to move the needle, because there's multiple things that are needed when it comes to the immune system. And vitamin D is actually just one of them. Okay. And I'm going to give you a clinical example. Here's a woman who came in. She scheduled a consult with me, and she said, I've been having a lot of heart palpitations. And I said, all right, well, yeah, you are, in getting ready to go into menopause. So there might be, a problem with some of your estrogens. There might be some problems with adrenal stress. There may be a problem with estrogen reception that might be going on. So we ran some panels, and one of them that was included in the panel that we do was vitamin D. And I looked at her levels, and her levels were sky high at 142. And so I looked at this and I asked her, I said, do you get any heart palpitations? And her jaw just dropped. She's like, oh my gosh, yes, all the time. I said, well, how much vitamin D are you taking? She says, well, if I get the sniffles, I take 25,000 IUs, and then I try to take 10 to 15,000 per day. And one of the things you got to realize is vitamin D is a fat soluble vitamin, which means you can store it in the body, unlike B vitamins or vitamin C. But vitamins A, D, E, and K, you can store within the body, which you can actually take too much of it. And in her case, she was taking entirely way too much vitamin D. You know what I told her? I said, don't you dare touch vitamin D for 90 days and get your levels retested after 90 days. She says, well, what about my immune system? I'm like, your immune system is fine. It's not going to function better if it's at 70 or if it's at 140. Your levels are fine. And in fact, in 90 days, that's usually the half-life of vitamin D. So she literally could just go into a dark room, not get any sun exposure, not consume any vitamin D, and her levels after 90 days would get down to about 70 or so. Okay. So vitamin D, huge misconception, guys. Here's another misconception too. Chiropractic care takes away acute pain. And even for me, yes, I do adjust patients still, but I see people that decide I'm coming in because I'm in acute pain. Oh man, and they think like the chiropractic adjustment is somehow going to take away acute inflammation. Here's the truth. You cannot speed up the acute inflammatory process. You can't speed it up. And in fact, if you injure yourself, the acute inflammatory process, look up any textbook, and it will last anywhere from about 7 to 14 days. But does that mean that chiropractic gets rid of the pain? No, it won't get rid of the pain. You'll get off the table and you'll still be acutely inflamed. You'll still be in pain, But here's one of the things that can help you, because if you have an injury, let's say you have a disc injury to L5, and man, that can cause a lot of acute pain. But the problem is this is why early motion is so important. So if you get it moving early and you start getting it moving correctly, one of the things that will help is it will help with excessive scar tissue, invagination within that area. So anytime that you have an injury, you'll get scar tissue, and the scar tissue will start to heal like this. So you want to start lining up the scar tissue according to lines of stress as quickly as possible in order to get mobility back. And this is why you'll see so many people who they have an injury, they don't do anything, they don't get the mobility back, and then they wonder why their body is so chronically stiff. This then leads into a lot of chronic inflammation as well. So I think this is probably a dirty secret, and unfortunately, I don't think it's I don't think it's a dirty secret in chiropractic just because they're trying to hoodwink you. I just think that there's a lot of chiropractors who don't understand the acute inflammatory process. So people like get adjusted, the acute inflammation goes away, and then they say, "Oh, the adjustment took away my pain." No, it didn't. Probably would have gone away on its own had you not gotten adjusted. The problem is that um, uh, the uh, the uh, the adjustment doesn't speed up the acute inflammatory reaction. I don't care how you cut the cake; it's going to be inflamed. Anywhere from 7 to 14 days. And that's what I tell people. I say, "Hey, you got a new injury. I'm going to adjust you. This is going to help with movement and mobility. However, it's still probably going to be bothering you for the next 7 to 10 days. And if it doesn't, it means it's not healing correctly. So then I want you to come back, and then we'll kind of reassess and go from there." Okay. Here's a perfect example of X-rays. Okay, so this is a lower back X-ray, and so what you see is the lower part of the spine. In fact, this is the very lowest part. This is known as L5. Here's the belly over here, and here's the back of the spine over here. And then if you look at this vessel right here, you're not supposed to see this vessel on X-ray, but you see it because it's the aorta. And the reason why you see it is because it's so calcified due to chronic unrelenting inflammation. And in fact, you also see the presence of a lot of spurs and degeneration and deterioration that's taken place. This person who came in had a ton of chronic pain in literally every single joint of his body. Structurally, you can see he wasn't that bad. So why was it just filling up with calcification? And why was his aorta filling up with so much calcification? Because he was so chronically inflamed. This person had blood sugar issues that was just running rampant, out of control. The doctors were just doing a this for that approach and just dumping a bunch of insulin, but his blood sugars were still out of control because he was so insulin resistant. And you can see the result of having chronic elevated blood sugars for such a long period of time, how it just started damaging all the soft tissues. So you see the ligaments, soft tissues. You see the aorta, which is soft tissues. And he was also in had chronic kidney disease and nearing kidney failure at that point, because elevated blood sugars for a long period of time will just run a huge number on kidney function long term. So, at that point, I looked at him and I said, you know what? Adjusting you, yes, it can help you. It's going to be completely palliative. But you know what I would do too is the thing that would be the most important is start handling the chronic systemic inflammation if you really want to start moving the needle forward. So, adjusting the spine is going to have a limited benefit if you stay chronically inflamed. So not everything is just an adjustment for pain, guys. You got to get out of that model, especially. Here's a misconception too. Having a well-functioning immune system means that I will never ever get sick. Oh man, I see this all the time. Oh, my immune system is perfect, and if I get sick, there's something wrong with my immune system. Here's the truth. I don't care how well your immune system is functioning. You can have a perfectly functioning immune system, but if you have your first exposure to a pathogen, it means that you will get, and I don't like to say sick, but you will get inflamed. And that is the body. That just means that because, remember, any first exposure to any kind of pathogen, you're going to get inflamed. The immune system has to respond in a way in order to start overcoming that pathogen. And let's say, my children have a really high functioning immune system. Doesn't mean that they'll never get chicken pox. Doesn't mean that they'll never ever get measles. Yes, they will get measles, but the problem is or the good thing is if they have a normal functioning immune system, it means that they will get over it. So everybody says, well, I'd never ever get sick. Well, listen, if you've never had exposure to measles, or if you've never had exposure to chickenpox, your first exposure, you're going to have symptoms that the body is trying to overcome those things. And it doesn't mean that the immune system is weak or off. It means no, the immune system is doing exactly what it is supposed to do. So having a well-functioning immune system means that you will get over it. It means that you'll get over it. But the problem is that people think that I should never ever get sick. And this is why I will always say it's all about strengthening the host, not about weakening the environment, because most of medicine is all about weakening the environment, meaning stay away from people, don't get exposed, wear a mask, and then vaccinate the crap out of your body all the time. And you'll see we're starting to see that things are starting to go sideways when it comes to that, because there's no way that you can avoid a virus. There's no way that you can eliminate a virus. They talked about, oh, we eliminated measles. And I'm like, no, you didn't. If you truly eliminated a virus, it means that it will never, ever come back. But you see how they say we eliminated a virus. Then in the next breath, they're saying, but keep getting vaccinated for it so that it doesn't come back. And I'm saying, well, then you didn't eliminate it. You never eliminate it because viruses are always everywhere. So this is why the same thing. Guys, I had COVID. It was a 1-day fever, and that was it. And the reason why is I had a well-functioning immune system, but I had symptoms of my first exposure. It's the same thing. Same thing with measles. It's also the same thing when it comes to whooping cough or pertussis. About a year and a half ago, our whole family had pertussis, minus my wife. I don't know why. The hand of God was on her. But my at that time, he was 18 months old. My youngest had whooping cough at 18 months old. And basically he was just normal, just running around coughing. Got over it within about 10 days to 2 weeks. But here was so interesting is that I also came down with pertussis as well, and I had been vaccinated for it. Interesting, huh? And I ended up having a cough for about 100 days. And yes, I was pretty miserable, but I also got over it. And I wish that I had actually had it naturally when I was young, because my kids too also had it. And it was a lot less severe for them than it was for me, having pertussis and having 100-day cough, and even having the vaccine for it too as well. So kind of makes you wonder. So, but it's always about strengthening the host, not about weakening the environment. But if you do have a well-functioning immune system, it doesn't necessarily mean that you'll never ever get sick. You'll get sick, but your immune system will be strong enough to be able to overcome it. That's why I always say, why can two people get exposed to the same virus? One person, dies from it. The other person is sick for a week and they get over it. It's the same virus, but the difference is the strength of the host. And that's why no one's talking about, making the host stronger. They just talk about weakening the environment. Okay. All right, guys. Another misconception when it comes to health that we probably have fallen for is that doctors are experts in health. Doctors are not experts in health. Doctors are experts in what makes you sick. That's what they're experts in. They study what makes you sick, but they are certainly not experts in what strengthens your body and what makes you well. The Wellness Way doctors are experts in what makes you well. I will tell you that. Now, if you want to try to figure out, oh, well, what's making you sick, then go to the Mayo Clinic. They'll probably run $20,000 of tests in order to try to figure out, what's making you sick. But there we go. But you should be focused on, well, if I got sick, what are some of the things that I can do in order to work on building health? Okay. And here's just an example. These are just people who recently came to me, very recently. I had a woman who came to me. She's had a urinary tract infection every month for 4 years. Now, in the chat, in the comments, go ahead and put what the doctors gave her every time she had a UTI. And I guarantee you'll type the right thing in. Yep, there it is, an antibiotic. So she had been on multiple rounds of antibiotics. Had another young girl who came in who had strep throat and during that time was on 8 rounds of antibiotics. The antibiotics, she finished her course of antibiotics. Strep throat would start to come back. Had another individual who was on high dose insulin for type 2 diabetes. Yet his blood sugars were still out of control, and they just kept pumping him full of insulin. And then also, if you come in, you have low testosterone, then they want to just start doing testosterone replacement therapy versus trying to look at the lifestyle factors that could cause low testosterone, whether it's sugar, alcohol, insulin resistance, poor sleep. There's a lot of different factors that are at play here. And so that's why you need to figure out, well, what makes you well, and start working on removing some of the things that are actually driving down your hormones. And that's why we talk about inflammation talk a lot about inflammation within the Wellness Way, and talk a lot about the inflammation event that's going to be coming up. But I want you to think of this, is that a lot of medicine is just a simple linear approach to health. They just say, it's just this for that. You have this, take this. You have this, take that. But in reality, the body works a lot more complex than that. That's why we call it the Swiss watch principle, that everything starts to affect everything. And he's got to start looking at that. Yes, the stress affects everything. My gastrointestinal health affects everything. What I eat affects everything. My liver health affects everything. It affects my skin. It affects, not just the liver. It affects the gastrointestinal system. All these things run together, and that's why you need to stop looking at it as a this for that approach. Okay. Last one, guys. Misconception. My body makes mistakes. My body makes mistakes. How many times your doctor said, oh, your body is making a mistake? I'll give you a perfect example. Just go ahead and look up autoimmunity and look on WebMD, look at the Mayo Clinic, the Cleveland Clinic, and they say autoimmunity is when your immune system mistakenly attacks your own tissues. You can't make this up. And the reason why we've been able to get tremendous clinical results when it comes to autoimmunity, when it comes to all those different things, is I'll always ask the question, maybe the body isn't messing up because the body's not programmed to make a mistake. Think of your immune system. Is your immune system programmed to start attacking healthy tissue? Your immune system is biologically programmed to start to go after diseased, infected, or damaged tissue. So you have to start asking the question, well, is there some kind of infection that could be going on? Or is there some kind of damage happening? And why would that damage be taking place to cause the immune system to start to try to clean out damaged tissue? And so your body doesn't make mistakes, but your body does adapt. Your body is always adapting, trying to fight for survival. And the problem is that while it's doing that, you just don't like the symptoms. And so you want to call it some kind of disease, and in reality, the body is not making a mistake. It's trying to fight for to try to adapt and to try to survive, to try to keep you alive. But you just don't like how it makes you feel when the body is doing that. So here's a final thought. Guys, your body is begging. Your body is begging for you to listen. It's giving you clues. It's giving you warning signs. And here's what I want you to do is I want you to start hearing it before it becomes too late. Is there a time where it can be too late? Yes. Is there a time where I have to kind of just throw up my hands and say, you know what, the damage is too severe, that the body won't be able to overcome this using quote unquote natural methods or whatnot? And I've seen some people who've been able to come back that are pretty far gone. But the problem is there a time where there is just too much that the body can't overcome? And the answer is yes, absolutely. But in order to get there, then one of the things that you really have to do is you really have to ignore it or not acknowledge the warning signs or just try to hush them up or cover them up for a long period of time. And then it becomes too late. My number one thing, my prayer for so many people is that they don't wait, that they don't wait before it becomes too late, that they really start listening to their body and they start acting, that they're not trying to treat disease, that they try to build health before it becomes too late. And this is one of the reasons why coming up tomorrow night on Tuesday, November 4th, is our inflammation event, guys. When you come to that inflammation event, this is an in-person event, Chicagoland area only. But when you come to that event, I guarantee you, one of the biggest things that I see people that they start to understand, when they start to understand it, their eyes start to get really big and they say, oh my goodness, I wish I just would have seen it from this way a long time ago. But at that point, if you want to work with us directly, I'll show you exactly how you can start working with us directly so that you can start reclaiming your life. And this is why I always ask people, and I ask people at the end of the inflammation event, I ask them this: do you want to be manipulated or do you want to be restored? Everybody says restored, but watch this. If you want to be restored, some of you are going to have to work very hard to try to work on getting your life and start getting your health back. But where it actually starts is you have to start thinking differently, because you cannot, excuse me, solve your problems with the same level of thinking that created the problem. And this is why so many people have struggles when it comes to going into the allopathic healthcare model, is because they don't change the thinking that created the problem in the first place. So if you want to be restored and not constantly manipulated, then what I want you to do is I want you to go ahead, click on that Linktree profile, click on the inflammation event, and get registered for it tomorrow night. Change your plans, because I always tell people is, if you got something that's going on, well, then a month later, you're going to have something that's going on too. So what I want you to do is I want you to click on that link, get registered, and act, and be at that event coming up tomorrow night at 6:00 p.m. um, for the inflammation event. And then also as a final reminder too, remote consults, men only, contiguous United States. That's the criteria. And then just call our office at 630-553-6149. So 630-553-6149. So if you are out of the Chicagoland area, you want to work with us remotely, go ahead and call us. My staff will give you a call back and we'll get you set up for a remote consult with me personally. I'll call you. We'll do a history. We'll look at any labs that you have. And then if I need some more labs to look at, I'll point you in the right direction, and then we'll be able to go from there. So common health misconceptions you might keep falling for. So I want to make sure that you watch this so you don't keep falling for the same misconceptions that we tend to fall into every single time. And don't become this, okay? Don't become this. You have to live your life very conscious, and not just live your life just going from event to event to event. This is why I'll even say this to my staff: don't be a flag, be an anchor. Be rooted, be grounded, and don't be a flag that just flaps in the wind according to the next health crisis or the next health emergency. Become an anchor. Don't become a flag, and don't become like the sheep that keeps falling in the same hole and wondering why they ended up there in that first place. So guys, I hope this live video helped you. And if it did, do me a favor, share this video with other people. And if you don't follow us, I'd appreciate a follow too, because every week we go live on Monday nights. I will be going live next Monday as well. Topic yet to be determined, but I'm sure it will be a good one. So, guys, I will see you next Monday for a live broadcast. And also, if you follow us too, we'll always be putting out great content for you to enjoy throughout the week. So, guys, appreciate all of you on this live broadcast. Be well, be blessed. Remember who you are, and I will see you guys next week.